Heart disease is the leading cause of death in the United States, according to the CDC. Millions are affected every year in the US, and hundreds of thousands are projected to die from the disease in 2025 alone. The fact that it exists in exponential numbers and is ever increasing indicates a need for ongoing public health information, educating the public about proactive approaches and preventative measures. Studies have shown that over half of American adults are still unaware of the severity and seriousness of heart disease in 2024. This suggests a serious gap between public awareness and knowledge. In 2021, in the United States, coronary heart disease was the leading cause of deaths. It was attributed to cardiovascular disease in the US, followed by stroke, other cardiac issues, high blood pressure, heart failure, and diseases of the arteries. So I wanted to highlight the prevalence in the US of heart disease and why we chose to promote the practice of taking your own blood pressure at home for the middle age group. This includes the ages 40 years to 65 years old. There are many other signs and symptoms to watch for, and of course, any change physically, you should consult a medical professional like your general practitioner. But learning how to take your own blood pressure can help indicate the need for a doctor's appointment when you may not be symptomatic of a serious illness. There are many different sorts of home blood pressure monitors, so you will need to follow the instructions that come with yours. Some have an arm cuff and some have a wrist cuff. Measure in a quiet room after you have been still for 5 minutes. Keep still while reading and take 2 or 3 readings, each about 1 to 2 minutes apart. Keep a record of your measurements just to look at following trends. I want to briefly explain what blood pressure is. As the blood moves around the body, it puts pressure on the walls of the vessels. Blood pressure readings are made up of 2 different values: systolic blood pressure and diastolic. Systolic is the pressure when the heart beats, while the heart muscle is contracting and squeezing and pumping oxygen-rich blood into the blood vessels. Diastolic blood pressure, this is the pressure on the blood vessels when the heart muscle relaxes. Blood pressure is measured in units of millimeters of mercury. The readings are always given in pairs, with the upper value first, followed by the lower value. In adults, blood pressure is considered to be normal under a systolic value of 140 millimeters of mercury and under a diastolic value of 90 millimeters of mercury. Next, in our video, you will see Valerie demonstrate how to properly apply 2 different types of automatic at-home blood pressure cuffs. Lastly, you will see Peri demonstrate how to use a manual cuff to measure blood pressure.
One way to take your blood pressure at home is with an automatic machine, just like so. First thing you want to do is place this cuff on the upper arm about 1 to 2 inches above the bend of your elbow. You want to make sure that it is nice and snug, but not too tight. So you should be able to fit 2 fingers underneath it. Once you have it on and nice and snug, you want to press the start button. Click. Once that starts, you want to rest your arm on a flat surface like a table, making sure that upper arm is on heart level. You want to make sure you stay silent during the measurement. No talking, no moving, just breathing. Making sure you sit up nice and straight. Keep your feet flat. Do not cross. One way to take your blood pressure at home is with an automatic machine, just like so. First thing you want to do is place this cuff on the upper arm about 1 to 2 inches above the bend of your elbow. You want to make sure that it is nice and snug, but not too tight. So you should be able to fit 2 fingers underneath it. Another way to take your blood pressure at home is using a wrist cuff like so. First thing you want to do is place this wrist cuff on your wrist. You want to make sure it's about 1/2 inch to 1 inch above your wrist joints, making sure your palm is facing up. Press that start button, click. Once you press it, place your arm down, rest it, I should say, heart level, mid-chest. Keep it nice and steady, no moving, no talking, just breathing. Breathe in, breathe out, relax. And then once you feel the cuff deflate, that means you are done and able to record your records like so.
First, we're going to make sure that we're rolling up the sleeve so we really get some contact with the skin. We're going to need our stethoscope and our blood pressure cuff. I'm going to unravel that blood pressure cuff and get it wrapped around her arm snugly right above the brachial artery, which is found on the inside of the elbow. Here I'm lining up the arrow with the artery. Then I'm going to go ahead and grab my stethoscope and I'm going to place the diaphragm part, the bigger part, over the stethoscope. Now I'm going to inflate the cuff to about 180 or 160, your preference. And here I'm going to lightly loosen the cuff until I hear the first sound, which I did. And then keep on ticking. You want to go pretty slow until you hear the last sound, and I just did. And that's going to be your blood pressure.